Hare Krishna, Sadhar Pranam. A very warm welcome to the day 33 of my YouTube channel, Dental Tips. Today's topic of discussion, today we are going to discuss pulpectomy procedure in a tooth number 65, that is deciduous maxillary second molar. And the scenario out here is that an 8-year-old child, she approaches her dentist. And her chief complaint is she has severe pain in one of the tooth which she is not able to locate, that which tooth is the problematic tooth which is causing her pain. The pain is radiating and it's severe, spontaneous and sharp pain, and she has sensitivity to hot, cold and sweet foods and beverages. And when she consumes something hot, whether it is a food or beverage, it causes sharp, spontaneous and very severe pain. And on consumption of something cold, food or beverage, on consumption of cold, the pain subsides. And despite that, there is a foul taste in the mouth and there is a bad breath. So the child patient, she approaches a pedodontist. And when the pedodontist does the intraoral examination, he finds out that there is this particular tooth numbered 65, which is classified according to FDI, tooth numbering system. That particular tooth is maxillary second deciduous molar, and that tooth has gross caries. That dentist, that pedodontist, he takes X-ray. Probably the X-ray taken is IOPA, intraoral periapical radiograph, or RVG, radiovisiography. So when the dentist takes the X-ray, the dentist finds that the caries has progressed to the pulp, and owing to which the problematic situation has arisen. So the diagnosis is irreversible pulpitis, and the treatment planned, the treatment modality which is to be given, that is pulpectomy. Now it's to be noted out here that the child is 8 years old and the tooth afflicted with dental caries causing the problem is a deciduous tooth. It's deciduous maxillary second molar, and it's ultimately going to be replaced by a permanent successor, that is permanent maxillary second premolar. But there is a time for that permanent successor, that is permanent maxillary second premolar, to erupt. It erupts usually at the ages between 10 to 12 years of age. And the child is just 8 years old. So the dentist decides, the pedodontist decides to save the tooth via pulpectomy. So the first step out here is after deciding the treatment modality, the first step is the dentist, the pedodontist, places a rubber dam around the tooth number 65, that is deciduous maxillary second molar, and rubber dam isolation is done of that required tooth. And then thereafter dentist gives nerve blocks, that is posterior superior alveolar nerve block and palatal injection, and we will discuss about these nerve blocks in the upcoming videos. And then what does the dentist do next? Next, the dentist is going to take a round burr, and with the round burr, dentist is going to excavate all the carious lesion. And after excavating all the carious lesion, the dentist is going to locate the canals. Now, since it is deciduous maxillary second molar, the number of roots are 3: distobuccal, mesiobuccal and palatal root. And the canals tract, number of canals located, they are 5. In the mesiobuccal root, MB1 and MB2 canal is located, mesiobuccal 1 and mesiobuccal 2. In the distobuccal root, distobuccal canal is located, and in the palatal root, again 2 canals are located, palatal 1 and palatal 2. So dentist locates these canals, and dentist extirpates the pulp from the pulp chamber and the pulp canals. And then after that, what does the dentist do next? Dentist places the file in all these 5 canals. Dentist places the files and takes a working length X-ray. Again, it is RVG, radiovisiography, or IOPA, intraoral periapical radiograph. And after taking the working length X-ray, what does the dentist do next? Next is dentist starts with the next step. And that next step is BMP. BMP is also known as biomechanical preparation or chemomechanical preparation. So now the dentist is going to take number 8, number 10, number 15 and number 20K file. Dentist is going to coat these files with prep canal, and dentist is going to shape all the canals, all the 5 canals located. Dentist is going to do filing in all these 5 canals. And after doing filing in all these 5 canals with file number 8, 10, 15 and 20 K file, after using that particular successive file, dentist is going to irrigate all these 5 canals with the chemical irrigants. And what are the chemical irrigants used? The chemical irrigants could be sodium hypochlorite 1%, chemical irrigants could be chlorhexidine 1%, and the chemical irrigant could be normal saline 1%. So after irrigating the canals and using the successive files in all these 5 canals, what does the dentist do next? The next step is dentist takes a GG drill. GG drill is Gates Gilliland drill, and dentist will enlarge the orifices of all these 5 canals located. And after enlarging the orifices of all these 5 canals located, what does the dentist do next? Next, the dentist will take endo-Z burr, and with the endo-Z burr, dentist is going to refine the excess cavity shape. And after refining the excess cavity shape, the dentist, what is he going to do next? The next step is dentist will take this kedo square file system, and from the kedo square file system, dentist will take kedo square file. And again, that will be coated with this prep canal, and again filing will be done in all these 5 canals, and again irrigation will be done after that. So after that, the dentist proceeds to the third step, that is obturation. And prior to doing obturation, dentist is going to dry all these 5 canals. And how is the dentist going to dry all these 5 canals? Using paper points. After drying all these canals, 5 canals, dentist is going to place an obturating material in these 5 canals. Now, since the tooth we are treating with pulpectomy is a deciduous tooth, and it's likely to resorb when the permanent successor will replace it, so we will place a resorbable obturating material in it. And we will not use gutta percha as we use in permanent teeth. We will use a resorbable obturating material, and that could be zinc oxide eugenol, that could be calcium hydroxide, that could be iodoform, and it could be a combination of calcium hydroxide and iodoform, which is available in the market by trade name Metapex Plus and Vitapex. And after obturating all these 5 canals, what does the dentist do next? Next is dentist is going to place a post-obturative restorative material in the canal, in the pulp chamber. And after obturating these 5 canals with any of this obturating material which I mentioned, Metapex Plus, Vitapex, calcium hydroxide and iodoform or zinc oxide eugenol, after obturating with any of these materials, the dentist is going to place a post-obturative restorative material, and that is GIC, glass ionomer cement. So after doing the post-obturative restoration, what does the dentist do next? The next step is dentist is going to do tooth reduction, crown preparation, tooth reduction for preparing the tooth for the particular crown to be received by the child. So in accordance whether zirconia crown is given or whether stainless steel crown is given, according to that the required tooth preparation will be done, and then the crown will be seated in the particular tooth, and with this the procedure ends. That is what is pulpectomy, using hand file system and kedo square file system. So that's all for today. Thank you many folks for watching my YouTube channel. Jai Shri Krishna.